And today we're talking about the silent kidney failure symptom. I'm giving you 5 signs and symptoms of dehydration damaging your kidneys. What is dehydration? Dehydration is a condition that occurs when your body has lost too much fluid. And when the kidneys don't see enough fluid, when they don't get enough blood flow, enough pressure, enough perfusion, that can definitely lead to kidney failure. Now, there are certain things that can cause dehydration. If you have vomiting, diarrhea, if you have excess sweating, it can lead to dehydration. Also, if you have a high fever, or if you simply don't drink enough water, you can get dehydrated. Who is at risk for becoming dehydrated? Well, if you're a person who exercises a lot, especially if you exercise outdoors when it's hot and you do a lot of sweating, but you don't drink enough water, you can become dehydrated. If you have a job that requires that you work outdoors, you're doing this strenuous labor, you can get dehydrated. Infants can be at risk because they lack the communication skills to let people know when they're thirsty. Oftentimes, elderly people don't get that thirsty and they can get dehydrated. And if you are a person with dementia, you are at risk. Also, there are certain weight loss medications that can put you at risk because the weight loss drugs will keep you from having a big appetite, but they can also, in some cases, cut back on your thirst and you can become dehydrated. And of course, if you just don't like drinking water, I have so many patients who say, Dr. Frida, I don't like water, and they don't drink it. And so, of course, they're at risk for becoming dehydrated. So now let's talk about 5 warning signs and symptoms of dehydration. Be sure to watch my YouTube video on the benefits of drinking water for your kidneys after you finish watching this video. Number 1, reduced or infrequent urination. What to look for? If you are urinating less than 4 times per day, you might be dehydrated. On average, most people will urinate about 6 to 7 times per day. So here's what's happening. If you are dehydrated, then your body is attempting to conserve the water in your body, and so you're going to make less urine. Now, over time, this can put a strain on your kidneys because they're trying to filter out waste from your body, but they're operating with less fluid than they need. Number 2, dark yellow or amber urine. What to look for? Look at the color of your urine. If your urine is darker than the color of pale straw, if it's darker than a really, really pale yellow, then it's too dark. And a great checkpoint is looking first thing in the morning. When you wake up, your urine should be a light yellow color. If it's a dark color, dark yellow, amber, brown, then that definitely could be a sign that you're dehydrated. And don't tell me that you don't look at your urine. You need to look at everything that comes out of your body. You need to look back at it or look forward. Whatever the case is, pay attention to the color of your urine. So here's what's happening when you have dark urine. When your body is dehydrated, it is trying to conserve water. And so it's holding on to the water and you're putting out a very concentrated urine. So when you see dark urine, that's a sign that your kidneys are dehydrated, they are under strain, they're under stress, and they're likely not performing optimally. Question: do you have a clever trick to make sure that you stay hydrated and that you drink enough water throughout the day? If so, please put that trick in the comments down below. Number 3, persistent thirst and dry mouth. What to look for? If you are feeling really thirsty, or if you have a sticky, dry sensation in your mouth, there's a great chance that you're dehydrated. And feeling this thirst is often one of the earliest noticeable signs of dehydration. So here's what happens. When you're dehydrated and your body's trying to conserve water, well, your salivary glands produce less saliva, okay? So that can make your mouth feel very dry and very sticky. So when you feel this sensation, do know that your kidneys are not getting enough fluid, they're not getting enough perfusion, they're under stress, and yes, this is one of those things that can ultimately lead to kidney failure. Now here's what's interesting. Yes, being thirsty and having a dry mouth can definitely be a warning that you're dehydrated, that you didn't drink enough water. But there are other things that can cause you to have a dry mouth as well. There are certain autoimmune diseases that can cause dry mouth. Also, if you have certain illnesses like diabetes insipidus, not the run-of-the-mill diabetes that most people know about, diabetes mellitus, no, something called diabetes insipidus occurs when you're making excess urine, you're making lots and lots of water, and that can lead to dehydration, even if you really are drinking enough water. So you want to make sure you consult your doctor to find out the reason that you're having dry mouth. But certainly, one of the common reasons is dehydration. And if that's the case, you want to increase your water intake. Number 4, skin elasticity changes. What to look for? If you pinch your skin and it doesn't pop right back into place, well, that could be a warning sign of dehydration. Okay, let's do a quick test. All right, so here I am. I'm pinching my skin. Okay, you see me pinching it? Oop, it goes right back into place. So I don't have that warning sign of dehydration. If it takes more than 3 seconds for your skin to go from being pinched to going back to normal, and if it stays in that kind of a TP or tint formation, that's called tinting, and that's a definite warning sign of dehydration. Yes, your body requires proper fluids, proper hydration in order for your skin to maintain its elasticity. If you see tinting, then that's a sign usually of pretty extreme dehydration, which also lets you know that your kidneys are under strain and you may be having pre-renal azotemia, which is a condition of your kidneys getting a buildup of toxins, okay, because they're not filtering well, and it's because they're not getting enough fluid, not getting enough blood flow from dehydration, among other reasons. So make sure you remain hydrated so that your skin is supple with good elasticity. Question: in your busy life, how do you remind yourself to stay hydrated? Please comment down below. Number 5, muscle cramps. What to look for? You know what to look for. It's a cramp. It hurts. It's when you get this sudden tightening in your muscle, a tightening, a contraction, like a Charlie horse. It hurts. It most often occurs in your legs. It can happen in your abdomen, in your arms, and it's a mess. And yes, a muscle cramp can be a warning sign that you are dehydrated and that this dehydration is damaging your kidneys. Here's what happens. When you're dehydrated and you don't have enough fluid in your body, when your kidneys are not getting the proper perfusion, and so they can stop working properly. You know that one of the functions of your kidneys is to help to maintain electrolyte balance. Well, if your kidneys are dehydrated and you're losing that electrolyte balance, you can have things like low potassium or hypokalemia, which can lead to muscle cramps. It's a mess. It hurts. You don't want it. Stay hydrated. Dehydration makes me mad. It does. It's frustrating because it's one of those silent causes of kidney failure that is very preventable. It's preventable. And so I'm about to give you some practical tips on how to prevent dehydration. Let's go. I'm giving them to you right now. First of all, drink water regularly throughout the day. Please don't wait until you're thirsty because then you're already dehydrated. You're already behind the 8 ball. For most adults, it's recommended that you drink anywhere from 2 to 3 liters of water a day. And so if you think about those 16-ounce bottles, like a typical water bottle size, drinking 4 to 6 of those each day should keep you pretty well hydrated. Consult with your doctor. Some physicians recommend drinking half of your body weight in pounds per day in water. For example, if your ideal body weight is 140 pounds, then it's recommended that you drink 70 ounces of water. Again, consult with your doctor because depending on what's going on with you, you may actually have a fluid restriction. For example, if you have lung disease or if you have congestive heart failure, then you might actually be on a fluid restriction. So make sure you talk to your doctor. Another way to prevent dehydration is paying attention to your urine. Yes, if something comes out of your body, look back at it. If your urine starts to become a dark yellow or an amber color, then you know it's time to drink more water. Eating foods that are high in water. That's another wonderful way to prevent dehydration. Eating foods like cucumbers, celery, watermelon. These types of foods can help to hydrate you even without directly drinking water. Also, you want to avoid drinks that dehydrate you, okay? So if you're a big coffee drinker, you know coffee has a lot of caffeine, and caffeine actually makes you urinate more. Same thing with alcohol. If you're drinking alcoholic beverages, that can make you urinate more and lose water. And so you want to avoid excess alcohol for sure and excess caffeine. Another thing to try is an app. Grab your smartphone and download an app that helps to give you reminders on staying hydrated. When it comes to exercise, I definitely want you to exercise. Make sure that you are hydrated before, during, and after the exercise. Ooh, and here's a tip for small children. If you've ever had a child who's been dehydrated, you know, they might have a fever, they're sick, they just don't feel like drinking. If you're not careful, that child can get extremely dehydrated and actually need to go to the hospital to get IV hydration. Well, one way to avoid that is to not try to make them drink ounces and ounces and a whole bunch of fluid at one time. They might not be in the mood. But if you get Pedialyte and you put on their favorite TV show or their favorite cartoon, and at each commercial break, say, hey, drink this tablespoon of fluid, drink this tablespoon of Pedialyte, drink this tiny little cup of water, and we'll get that going with the TV program. If you do that, it may be a slow road. It may take you an entire, hour of a TV show, but they're more likely to keep the fluid down. And if you, bribe them a little bit with something that they enjoy watching, you can keep your child hydrated. Be sure to consult with your child's pediatrician about this tip. So there you have it. We have just broken down dehydration, the silent kidney failure symptom. If you found this information to be helpful and informative, please be sure to like this video and to share it with the people you care about.